My name's Ian, and I'm here to talk about Central Auditory Processing Disorder, or CAPD. I chose this as my project topic because I suffer from CAPD, along with a bunch of other learning disabilities, which I've always known my entire life. CAPD is a hearing impairment that doesn't register as a hearing loss on most routine screenings because it goes beyond the ear. Because it's past the ear, it doesn't separate meaningful information from non-essential information. A handful of symptoms to CAPD include difficulty hearing in the presence of ambient noise, or poor auditory memory, speech delay from a young age, and difficulty following auditory instructions, difficulty following along or keeping up in conversations, and those who suffer from CAPD often repeat huh or what, or can you repeat that? They also exhibit attention issues. Because they exhibit attention issues, it's often misdiagnosed as attention deficit hyperactivity disorder, or ADHD. Children that are suffering from CAPD often lose confidence or feel insecure because of their disability. They feel like instead of getting help, they're getting criticized or punished because they're always asking, what did you say, or can you repeat that? Some children even go as far as to become isolated or depressed because of these feelings. Others will become disruptive or become thrill seekers. Some children even become cynical or argumentative to mask their disorder when they're criticized. There are a handful of subtypes to CAPD. There is auditory decoding, which is auditory discrimination difficulties, especially in the presence of ambient sound. Integration subtype, which is makes tasks that require both sides of the brain very difficult for those who suffer from CAPD. Associative subtype, which sometimes called repetitive language disorder, presents with receptive language difficulties, especially with regards to the meaning of speech, like semantics, basically. Output organization, which basically is difficulty in recalling information in a specific order, or problems with articulation. And prosodic subtype, which presents as a challenge with the prosodic elements of speech, such as tone, and pitch. There are several tests to diagnose somebody with CAPD, such as the electrophysiological test, which utilizes a cap with built-in sensors that register the brain's activity or electrical activity in response to auditory stimuli. One of the most common tests for CAPD is the dichotic digital test. This test encompasses 4 numbers presented simultaneously or overlapping, and the child is asked to repeat the 4 numbers heard. For example, the number 5 could be presented in the right ear at the same time that the number 1 is presented in the left, and then the numbers 9 and 6 are presented simultaneously to the right and left ears. Then the child is asked to repeat all the numbers heard, and that the percentage correct determines the age-appropriate norms. A couple of other tests, just quickly, include auditory memory, tonal pattern recognition, and sound blending. One important aspect to address when it comes to children in the classroom that suffer from CAPD are classroom modifications. A common one would be a personal FM system, like a little radio, where the student is wearing an earpiece and the teacher is wearing a microphone. Now, this is one case where I get to say back in my day, because I was given a personal FM system, and back then it was just a little radio, a little rectangular radio that I would get, and a wireless microphone to give to the teacher. And I hated it so much. I was embarrassed that I had it, because every class I had to go to the front, give the teacher the microphone, walk back, turn on my FM system, and then get ready for class. At the end of class, I had to go back up, get the microphone, and then pack up and leave. So I just felt on the spot a lot doing it, and I just absolutely hated it. Another important classroom modification is just kind of reducing as much background noise as you can in the classroom by putting tennis balls on the chairs or rugs, or keeping the classroom doors closed at all times so that the student can pay attention better. Seating is also a very important modification. I remember before I had accommodations for my disorder, I always sat in the back and I could see everything. I could see every student in front of me. And if I could see him, I could hear him, which caused me to miss a lot of notes and things that the teacher said. So it's important that the student sits front and center so that they can focus on the teacher more. Another important thing is that the student has a quiet, peaceful place to study. They can focus on just what's in front of them and not on other things in the world. Basically, I brought this topic up because it's near and dear to me. It has made college very difficult, on top of having ADHD and several other learning disabilities. And I believe it is important that students are aware of their disorder and learn how to manage it. But more importantly, that the teachers or the loved ones or the family members learn how to manage it for the student, because it puts a lot of strain on social relationships. It puts a lot of strain on the classroom studies. It puts a lot of strain on work. And the biggest thing I can say to family members or teachers is to have patience with these students, because that's what they need. It's just very important to me that, because I felt like there wasn't much patience given to me as a student. I always felt criticized for not listening, basically. But yeah, I just wanted to make this video, not just for my class, but to put the message out there that to anybody that has CAPD or a loved one with CAPD, that you can do it, you can manage it, you can get past it. There are accommodations for you to help you through school, work, relationships, everything. And if I'm just a week out from receiving my undergrad diploma in psychology, then you can get through any amount of schooling. with this disorder. So yeah, thank you for listening,